And one sec. Alright, you're all set whenever you feel comfortable.
Alright, so my presentation is on the effects of depression on cancer patients. So doctors focus a lot on physical health, obviously, because that is their job. But mental health is also a really important concern when it comes to treating physical issues. It's realized that state of mind has a lot to do with quality of life. And I have personal interest in this because I have had personal experience with people in my life having cancer, and I think just about anybody can tell you one person that they know, whether it's an acquaintance, close friend, or a family member, that has also had an experience with some kind of cancer. I'm also really interested in how psychology plays into oncology treatment, which is the treatment of cancer. So my first popular press article was in the Miami Herald by Pearl. It said that most of those that are diagnosed will at some point experience negative feelings, depressive feelings, but for some it stays. So most people, they get these feelings around the first cycle of treatment, which is pretty normal, but like I said, for some people it continues on, and that's where the really important depression issues come in. Patients tend to be too self-conscious to ask for help due to the stigma of mental health, which is one of the main problems. And they also determined that cancer patients don't recover as fully because they don't want to do all the things that it takes to improve their physical health. My second popular press article was in Medical News Today, and that was by Paddock. That was saying that people with cancer can live well if they get the proper healthcare treatment they need, again, mental and physical. They were talking about how 1 in 5 patients with colorectal cancer were diagnosed with depression before their diagnosis, and then it just continued to get worse due to treatments and after diagnosis. They mostly discussed how doctors, again, need to ask their patients if they need help, make sure they focus on the mental as well as the physical health, because the mental plays a really important role into the physical health. My third popular press was by Radowitz, and it was in the UK News. They said that the chance of a cancer patient with depression dying is up to 50% more likely. That was the title of the article, actually. They were talking about different behaviors that go along with depression that could contribute to the problem, such as stress and anxiety. They talked about that a lot of patients aren't diagnosed. They may have depression. Actually, later they found out a very large number of cancer patients do have depression, but they were so scared of the stigma that they didn't talk to their doctors about it, and they were never actually diagnosed. They need to know that it's okay to ask for help, and doctors need to make that clear to them. So my first scientific article is by Spetkovic and Nenadovic. Their goal was to determine factors that affect depression. So they talked about a couple different things, namely age, education, their marital status, whether they lived alone or with other people. They talked about economic and occupational status as well. They used the Beck Depression Inventory Test to come up with a number to kind of turn the depression into a number. They found that depression is a side effect of a lot of different kinds of cancers, and that it decreases the quality of life. They also determined that it was one of the largest contributors to mortality alongside cancer. They concluded that age was a big factor, as well as the cycle of treatment. They determined that the first cycle of treatment had the highest risk of the strongest depression. My second scientific article was by Akechi et al. They talked about, or their objective was to find the quality of life in cancer patients with the depression. So it was patients that already had depression. They used HRQOL, which is health-related quality of life. That's what they used to determine things, and they were talking about how it was becoming more widely known as important. Again, it's not as important as it needs to be, but people are kind of starting to realize that it actually does matter. They said that mental health has a lot more impact, actually, than physical health. One, because if you just have a bad outlook, you don't want to get better. You just don't want to try. And also because if you have a negative mindset, then it's a lot harder to do the things that you need to get better for physical health. So you don't want to take your medicine. You don't want to do all the things the doctors recommend, which is a really, really big issue. They determined that patients with depression had a lower HUV, which is health utility value, which is, again, another way to put depression into a number. They used QALY, which is the quality adjusted life year. That was another numerical value they used. They used the HUV, the value, in addition to the length of their life, or the time they had cancer. and they also used the MD Anderson symptom inventory. That was one of the tests they used. And my third scientific article was by Cardoso, Grassa, Clute, Papuala, and Trancas. The study was to determine different causes of depression and anxiety in post-diagnosis cancer patients. So this was people who had already been diagnosed. They interviewed right before the first treatment, so on the day of their first round of chemotherapy was when they did the interviews. They found that women showed higher signs of distress, and also they had more advanced stages of depression, so it was a lot stronger. They also found that age was a significant factor. They used the hospital anxiety and depression scale, and rather than like the others used the Beck depression scale, they used a different one. So my audiences for the popular press and scientific articles really differed. For the popular press, it was more geared towards cancer patients and their loved ones. So it was for people who were looking to either A, prevent the depression in the people that they loved or in themselves, or to help make it go away. An example of that is Paddock. Their article was really low quality. It was really short. It was about a page and a half online. It didn't give a lot of information. It didn't give a lot of facts. It just pretty much just said there's a higher chance. And in my scientific article, it was more, or the scientific articles, it was more geared toward doctors and researchers. They were specializing in oncology. It used a lot of terms that were very difficult to understand. I didn't understand most of what I was reading. I know Sarah talked in her presentation about significance, and that was one that was used in mine. They also used something in Akechi et al. They used a lot of facts and names of tests. They did PHQ-9, which was the Patient Health Questionnaire number 9, but nobody else would have known that had you not looked it up, because if you didn't have previous knowledge, you wouldn't have understood anything that was in there. The arguments were fairly similar. Popular press just talked about how depression increases the chance of death. An example of this is in Radowitz. The title of the article was literally, breast cancer patients with depression have a 50% higher chance of death. So it literally just said that you have a higher chance of death. It didn't give any examples. And then the scientific articles talked more about how demographics play a big role. So in Cardoso, Grassa, Clute, Papuala, and Trancas, they talked about all the multiple factors that affect depression. So again, demographics. The evidence was pretty different in the popular press and the scientific articles. For popular press, they used a lot of studies that were already done. So like Paddock used the Macmillan Cancer Support Study. They didn't actually run any of their own tests. I think they only cited it once or twice, so mostly it was just common knowledge. The scientific articles created their own studies. So Akechi et al., they used tests that were already in place, like the PHQ-9, and then they just did the research from start to finish, all on their own. So the popular press was relatively accurate. Again, it didn't go into much detail, but it was all pretty much true. It was all supported by the scientific articles. The scientific articles, though, did show a lot more explanation. It showed you their methods from start to finish and gave you a clear conclusion about the answers. But they did reach pretty similar conclusions that depression was going to play a pretty big role in cancer treatment. The articles for the public were pretty watered down. Like I said, didn't give a lot of facts, but the scientific ones were definitely geared towards scholars. It was very clear that just any person off the street wouldn't understand it. Again, I hardly understood any of what I was reading. So I think the thing that is to be taken away from this is that mental health plays a really big role in cancer treatment. It really needs to be addressed by doctors, because if it doesn't get stopped, then there's not going to be a way to help cure cancer, or even just make somebody a little bit better, or their quality of life. References. Thank you. Does anybody have any questions?
All set. Thank you.